how I start my chart checking. Basically, I have these tabs here, and the summary. I go to adult overview, and then from adult overview, you can see I usually change it to 1 hour, and then in the hospital have a bigger screen, so you have like a better view than this one. So you will see like the trend of the temperature. So like you see this patient is spiking a fever now, and then you can see like the trend of the heart rate was in the 70s, now in the 120s, and then we can see the blood pressure is kind of dropping here. And the nice thing about the adult overview, it shows all the infusions, but we care about the pressors mainly. So he's on vasopressin, and he is on phenylephrine and levofed, and the other ones are basically just sedation, propofol, midazolam, and fentanyl. So
things are not looking good.
yeah, so we can see like his levofed went from 15 to 75 here. Phenylephrine is just added, and then vasopressin is just started like earlier today. So we can know like how we mentioned the blood pressure, and he's on 3 pressors now. Yesterday he was only on 1. So things are getting worse for this patient, it seems like. For oxygenation, I go to ventilation accordion. And this one, I usually just split it to 2 hours. So I have like a better detailed look. And then here I can see like he's intubated. This is a pressure control volume mode. And then here are the 2 things that I care about. FiO2, he's 100%. He went to 60, but then went to 100% again. And his PEEP is kind of like requiring a higher PEEP, a PEEP of 12 now. So these are the big ones. And then usually the ABG is down here. So the ABG is always supported with the labs. So we went to like adult overview for like all the vitals except oxygen. Oxygenation, I go to ventilation accordion. Third step is ins and outs, and I usually change this to 24 hours. And then I see what are the ins and outs in the last 24 hours. It's positive 600, and since admit, is positive 300. These are like the main ways. If I click here, I will see if he's making any urine output. If he's making any bowel movement, it will be mentioned here. If you go to the flow sheet, it will describe any bowel movements. Like if there is no bowel movement, so that it's not mentioned here. But if the patient passes any bowel movement, you will see the description here. Like the nurses will put like it's a watery stool or a formed stool. So that will also indicate if the patient having a diarrhea. So that was the third step, which is basically so adult overview, ventilation, ins and outs, and then labs after that. So for labs, I usually just go to results. I'm not sure whether the results are not.
Under chart review.
Yes, so labs, I usually have like a big tab here, but for some reason it's not popping up. Yeah. So these are the labs. So sometimes like the patient have like a million labs, and you kind of like start getting lost. So there are two tips about this. So either I go to current hospitalization or today's data. So the current hospitalization is important because it will show me the trend. So this guy, it seems like he's just showed up to the hospital, so he doesn't have many labs. So he just have like one CBC, one coag, one chemistry, a couple of chemistry panels here. So I just skim through these, and then urinalysis, microbiology, and then you can see this one. You can see any imaging that done today. If the patient has been there for like 10 days, sometimes you need to do like today's data just to see what labs are done today and see if they are changing. Imaging will show you the last imaging done here. And then after imaging, I usually just go to notes. And then when you need to go through notes, you just basically see that. So there's an AD note. There is an emergency, a couple of, I just put the preview and then just see quickly if there's anything worth mentioning. You can see here like the ICU PA. Sometimes like the nurses put some silly stuff, sometimes like important stuff. So I just skim through them very quickly. and by that I'm done with this patient. I know what I need to know, and then I will move to the next step and see the patient myself. So we'll go to the next step. So that was basically the first step, chart checking the patient in the morning. That's what you guys will do tomorrow for your patients. Bedside. So in the ICU, most of the patients right now, most of them are basically all intubated, all like knocked off, like being sedated. So you need to know like what are you looking for, or what are you doing when you're going to see the patient. So main thing, you need to talk to the nurse and the RT. They are easily accessible at the bedside. Just ask them any overnight events, what happened, anything worth mentioning, anything I need to know, and they know what to tell you. They are very smart people. They are very experienced in this ICU, and they know what to tell you. And if they have any requests, they will tell you, like in terms of orders or something to notify the attending about. Then just keep in mind you will need some time for PPE donning and doffing for every patient, because that will take time. Don't think like, oh, I just have only 3 patients. I can do them in 10 minutes. No, it will take you